Hello, welcome to NYC Health and Hospital Kings County YouTube podcast. My name is Pauline Wallace. I am the breastfeeding coordinator. I am joined by my special guests.
Hello, everyone. My name is Ayoka. I am the Lactation Facilitator here at Kings County. And we want to talk to you a little bit about why human milk feeding, also called breastfeeding, is the best choice for you and your baby.
I am not aware if many people knows that August is World Breastfeeding Month, and we would like to take this opportunity to educate our community on all the benefits of breast milk or human milk, as it is now called, why it is best for you and best for your baby. You may be also wondering what is the difference between formula and breastfeeding. Many of you will have your choice before you get to the hospital, but we are here to educate you on why it is important to try breastfeeding before you attempt to give any formula. Formula is similar to you buying something that is one size fit all, whereas human milk or breastfeeding is having your private seamstress, a designer that design your own outfit with your exact need, preferences, and measurement so that you can look your very best because it is made just for you. Formula has to be generic enough to feed any baby, but your milk, your own breast milk, knows what your baby needs to be in its healthiest and strongest development. Breast milk is also easier to digest. The health benefits for a newborn last throughout their childhood, helping them to have stronger immune system, higher IQ, and less health issues like ear infection, diabetes, diarrhea, and respiratory issues later in life. So basically, giving your baby breast milk will help reduce the incidence of diabetes, ovarian cancer in mothers. It will also reduce diarrhea and also respiratory problems. So breastfeeding is the best thing, So my recommendation is for you to breastfeed for as long as you can, most preferable from birth up to 6 months old. It's your choice, as I stated before. And we are very happy to do the best that we can to assist you in your journey. Miss
Absolutely.
Ayoka?
Absolutely, Pauline. Your recommendation is definitely on par and aligns with what's being said by the CDC, the American Academy of Pediatrics, and the World Health Organization,
Yes.
all of whom have set a global recommendation that human milk feeding be initiated within the first hour for maximum benefit. Placing the newborn skin to skin after delivery helps with neurological development, regulating body temperature, and stabilizing the heart and breathing patterns, especially in preterm babies. It also promotes comfort, bonding, and familiarity with latching to the nipple for the newborn. The milk available in the beginning is called colostrum. It doesn't appear in large quantities, sometimes only a few drops. But it doesn't have to. It's thick, yellowish, and every bead is packed with nutrients and antibodies to protect your baby. It's so special that it's often referred to as liquid gold. When the milk matures around day 3, it becomes a lot heavier, it appears whiter, and is filled with the right blend of fat, water, sugar, and protein that your baby needs.
Miss Johnson, you mentioned something about liquid gold.
Liquid gold.
Imagine that. Imagine that, liquid gold. Imagine you providing liquid gold for your baby. You cannot buy that in a store. You cannot buy that in the formula. It is something that is produced by your body, by the baby sucking at your nipple, sucking at the breast, sucking at the areola. So when you come in to have baby over an L&D and they place the baby skin to skin, that initiate that colostrum and initiate that liquid gold that Miss Johnson is talking about. So imagine, just think of it as this way. I will be providing my baby with liquid gold. Agreed, Miss Johnson?
Absolutely. And it's very exciting to see that colostrum come in,
Yeah.
especially for our NICU babies who need it the most.
Yeah.
After around day 3, when the milk becomes whiter and fuller, you may still see streaks of yellow at first, but that's fine. Does it hurt though?
Yeah, we get a lot of complaint about hurting.
Well, it shouldn't. Individuals sometimes experience discomfort when the baby doesn't latch properly or more milk is produced than is being used, for example. But these are occurrences that can be relieved with practice and techniques that we're always ready to share. From our prenatal clinic to labor and delivery, postpartum, and even after discharge, we're here to support you. Kings County is a certified baby-friendly hospital, and we're proud to support you and your feeding choices for the best possible future for your baby.
So my recommendation is for you to have a feeding plan in place when you come to deliver here at Kings County Hospital.
And if you have any questions before you deliver or even after discharge, feel free to call us at 718-245-2428 or 718-245-2820. Pauline and I will be more than happy to answer any of your questions. We're located in the C building on the 5th floor, room C5202. Breastfeeding support in person is available on Wednesdays at 1 p.m. with appointment. See you then.